dear students, today we have got with us one of my favorites, Dr. Naseema, who's got a fabulous rank in FET 2023. She's got rank 4, which was not a surprise to me at all. Many congratulations for this success, Dr. Naseema. Let's hear your story. The students, these interviews are very important. The students keep waiting for these interviews to get some tips and tricks from you all, from the topper. So let's start with your story. Where did you do your UG and PG from, Dr. Naseema?
Ma'am, I'm basically from Tamil Nadu. I did my UG from Salem. It was a semi-private medical college. And from there, I took a break for 1 year for preparation. And then I did my post-graduation from Maulana's at Medical College. I was a 2023 pass out, ma'am.
23 pass out. So this is your first attempt?
This was my first attempt in FET.
Oh, wonderful. So let's start from your PG days. How was your reading in your PG times?
Ma'am, we were COVID batch. So we started with COVID. When I entered, it was a full-fledged COVID. So the first year was fully into COVID. Almost like both the waves was attacking Mamsi. So it was a complete full-fledged COVID hospital. So the first year we couldn't do anything rather than just getting adapted ourselves to this COVID environment. And then second year was the proper first year we had, and we had a long first year because our juniors were very late. But then my unit was very chill unit. So my consultant was more interested into studies, and she was more interested in taking classes and all. So my preparation started from my second year itself. I started preparing for my PG exam, like per se PG exam, from my second year itself. So
that time this was on your mind that you will do a super specialty exam?
Yes, ma'am. I was very particular कि I have to do something ahead. I was more into academics. I love studying, and that is something which is a part and parcel of it.
So, you love studying, so this rank was inevitable. Wonderful.
So I kept preparing.
You started preparing from second year.
Yes, ma'am.
Which books would you read?
Ma'am, I actually had my own notes. I started preparing my own notes from all the major texts. I had a beautiful set of seniors also. So Dr. Suvidya, and she was also my
Mamsi. A lot of those girls are my students in Mamsi, Lady Harding, all these places.
Yes, so a lot of seniors guided me. So I started preparing my own notes from the standard textbooks and the guidelines, like the OBS part, the onco part, and some amount of gynecology. I started preparing my own notes from the second year end, and by third year mid, I had my own notes for all these major.
All right, wonderful. So you already had notes from the big books by mid third year.
Mid third year, I had my notes.
How was the university exam then?
Ma'am, university exam, it was a single day stunt ho gaya tha. For me, practicals was good. It was in a different institute. Practical was not that great for me, but theory went well. And as usual, every 1 or 2 questions were unexpected. Uterine transplant was actually a question for us in our theory. Also. And in this NEET also, FET also, we had some.
There was a university. Yes, there were 3 questions. So for your university exams, how did you prepare? Did you prepare from your own notes?
Yes, ma'am. I prepared completely from my notes, and I used JB Sharma. To be very honest, JB Sharma was an amazing book.
For exam, you need a concise book.
Exam preparation ke liye, that is the best book. So I use that as my base, and on top of it, I add. For all the major ops topic and gynae topics and cancer, I had my notes. So I studied from my notes, and I used JB Sharma as a baseline, and I did my post-graduation exam.
Okay. So when did you focus your preparation to the super specialty entrance exam, the MCQ preparation? When did you start that?
Actually, I was pretty sure from the beginning that I wanted to do some specialty, but I was not sure whether it was gynae, onc, or FET cover. So initially in July, I purchased the Reproneet in August. Yeah, August I purchased the Reproneet because I've heard a lot about Reproneet from the beginning only. So I was very focused. I have to get this up, and I have to see your notes, and I have to start preparing. So, and then my mind changed for gynae. I didn't want to do gynae oncology, so my preparation slowed down. But by end of October, I went through all your notes and all your videos, and I prepared proper notes from your videos now. In fact, part to other than your notes, nothing is required for infertility part. Infertility was best. And even the ops part, a lot of things from my notes were missing also. And I don't know why, but a lot were missing. And oncology part was obviously, it was very extensive because the topic is only extensive.
Yes.
And gynae part also, ma'am. Matlab, I understood a lot of concepts from your videos, which the concepts were not very clear in the post-graduation period also. And that was more of a theory paper and a practical exam. So I didn't concentrate towards, answering an MCQ-based question.
Yes, the concept. For MCQs, you need to understand the concepts.
Concepts were very, very clear. Matlab, I went through the videos and there were certain topics which I went through the videos twice or thrice. Like this is second amenorrhea part, BSDs. These are all a nightmare topics.
These are my favorites. These are my favorites.
These were my nightmare topics from the PG, from the UG period only.
Yes.
The preparation period only, I didn't like these.
These were your nightmares. And after the coaching, this will become the easiest topic for you.
Actually,
it is one of those easy topics to answer.
I didn't go through the notes much. I kept repeating your videos only on these topics, especially there were few topics and infertility also, the protocols and the cryopreservation part and all. Matlab, I didn't understand this and I don't want to read the notes also again and again. I just kept seeing your videos. I would have seen those videos some 5-6 times. So, and every day I used to do it. Last days, I started my proper preparation from July, but then I had a break. Matlab, I didn't continue it properly. By October end, I started the proper preparation. From December and January, I started concentrating again properly for the FET. So in these 2.5 months, I just kept revising the notes and kept seeing your videos.
Oh, wonderful. Dr. Naseema, you're also very famous in the group because you kept answering the doubts. That is why I asked students to not question personally, to not send me questions personally because I cannot remember anything. And there are students who answer better than me in some questions, like yourself would answer everything. And it would be such a relief that, yes, she has answered. And I knew that if you have answered, it is going to be correct only. So that is the time when I realized that you're definitely going to get a good rank. So it is good that you were very actively participating in the Telegram discussions. Now, in Telegram discussions, what happens? Some students will try to answer others' questions by opening all the books and journals and references. That shouldn't be there. It should be there in your head. Your preparation should be so good that in the last 2 months of your preparation, just 2 months before your exam, you should be able to answer every question that is posted by a student in the Telegram group. So I think you had reached that level of preparation where you would confidently answer all the questions that they had sent. Actually, so it was very nice. And thank you for, contributing. That reduces my job by 80% because answering takes time. I, in fact, have to refer back to the books. But those who are preparing, they have everything in their mind. So thank you for being active in the group.
Thank you, ma'am. But ma'am, this is also one among the strategy. I would like to tell everybody to be, active in these groups, ma'am, because the questions posted in the groups are always the one which are confusing or which lacks clarity. Every one-liner answer this, but the questions in the group, since everybody were preparing, I felt almost 80-90% of the questions were really helpful. And even if I didn't know it, I used to go back and I used to see your videos. I used to go through it. So in that way, it helped me to recollect things also. So, and your questions which you use,
these are those unusual things which we forget and somebody else is reading. So you're reading what's there in your mind, plus you're reading what comes to their mind. So it is very helpful to stay in touch with the group, to be active in the group.
Matlab, this really, the Telegram group really helped me. Matlab, it was one of the important strategies in my preparation also. Matlab, I had the knowledge, I had the theory in my mind. I didn't know how to incorporate in the MCQs. So when people started asking questions, when my fellows started asking questions, that is when I got to know, okay, you have to interpret it in this way, and that is how you do things. That helped really a lot. And one more important thing which I really wanted to say is your recall videos, ma'am, because a lot of time during the preparation period, I used to be down, especially in the night or during the day also, because it's a very, I didn't go for any, I didn't join anywhere. So I was full-fledgedly sitting and preparing since December. So
this question is going to come. When did you stop your clinical practice? Like, what were you doing after your post-graduation?
Mom, I completed in July and then I joined in a corporate setup and I worked there for 3.5 months. I worked there. But then I felt that these are not my cup of cake. Matlab, I didn't like the job profile there. And then I decided that I have to leave this job, and because at that time I was expecting FET around February. The dates were initially in the February period. So by December end, I left the job and I was preparing full-fledged for 2.5 months. But then when the thing got postponed, it took a toll on my mental health also. I was down on a lot of times.
It gets stressful that I had planned to leave the job for 2 months. Now it is going to be 4 months.
It's going to stretch for another 4 months.
But still, you have to, be consistent during that time of stress also. You have to keep reading.
And that's what I want to say. Consistency in that time was very difficult. But one thing which really helped me was your recall videos. Whenever I was not in a mindset to study, I'll sit with the videos. I'll just listen to the videos. I won't do anything else. I'll just listen to the videos. And you used to comprehend everything. You would not just answer the question and answer for the question. You used to solve all the four options in this. And it was a very comprehensive thing. Seeing one MCQ will make me answer 4 to 5 questions in that. So the recall part really helped me. The videos recall was really, I suggest students that they have to go through this recall videos n number of times when they were low, especially.
Yes, last year also a student had told me that we got so bored preparing, and then your recall for the NEET SS, since the last NEET SS I've started doing this. So I started discussing NEET SS recalls, and then she started getting interest in preparation. So I usually do this before the exam. Just before the exam, we discuss the recalls. So
I went through all the previous videos, ma'am. Whatever videos were there, I just went
all the other recalls also, INISS recalls also.
I went through all the recalls, ma'am, because it helped me gain some new knowledge. But at the same time, important was brushing the old knowledge. I was able to brush up my old knowledges, which was there. And at that moment of time, I was not ready to study, but not ready to waste time also.
All right. So that it felt more interesting when you were not in the mood to read.
Yes, ma'am. It was really good. The video part was also amazing fun.
Thank you so much. I do put in a lot of effort to prepare for those. And that is why the classes keep getting postponed, because I have to prepare, I have to refer to it, I have to make it,
for every question, ask reference. So the students would ask reference for it, for every question now and then.
Yes, so I make sure that I have the reference. I'm not telling anything that I know, I have learned, or it is my belief. I tell everything which I've read somewhere, which is going to be asked or which is relevant for MCQs. So it takes time. I cannot just, give my knowledge to people. I have to refer from somewhere. And nobody can know everything. No, someone who's teaching you oncology also, infertility also, we have to refer to all the books. So it takes time to design a class and to schedule a class. That is why I think today's class also I'll have to postpone because of the interviews that I'm taking, because of the wonderful result that you all have given. Right, doctor, one more question. So how much time would you give to reading after you left your job?
Ma'am, per day.
Yes, every day.
Ma'am, I would used to spend some 8 to 10 hours.
Otherwise, 8 to 10 hours. Last 3 months you would read.
2.5 months, ma'am.
2.5 months you read straight.
So
you were sure. Yes. So you were sure that you have to crack this exam because you've left a job and you're not preparing for any other SRship. So you were sure that you had to crack it.
I was very...
And you had belief also that you will be able to crack it.
Yes, ma'am. I was quite confident.
What if you did not crack this? What was the plan B?
My plan B was to just go back to my state, and then do an SRship there and prepare for NEET SS. I was fixed in my mind that CMC productive medicine was my next target. I had
so the target was NEET SS.
And I knew that I had already the material. So I thought of giving the MRCOG also, DNBs also, so that I stay in touch with the academics and then to crack NEET SS. That was my plan.
So this plan B should also be there in your head, because everyone is preparing and only 30-40 people are going to get
And
seats.
This paper was, ma'am, very dicey. After exam, everybody asked me, how was the paper? I couldn't give a reply, how was the paper? It was 50-50.
But it was a good paper. It was a good paper. It was not bad like the last year's NEET SS paper. General questions, nobody knows what the answer is. I did not know where to refer to the answers from. So this time I was also very quick in solving the recalls because all the references were there. These were all good standard questions from books and guidelines and everything. So it was a good paper. And that is why all the students who had prepared well have got good ranks. So I like such paper.
It was a good paper. Retrospectively, now I can say it's a good paper.
Yes, it was a good paper. After the exam, what did you tell me? You had told me, yes, you had sent me the recalls.
Ma'am,
And you were
sat
taking
down. I took the effort because I wanted recalls help me. Matlab, I wanted to do
and
things
you
to help
know,
me also.
by the format of recalls that you send me, I can guess your ranks. Some students have sent me recalls where I when I would compare their recalls to your recalls, I would say that this girl is definitely going to get a very good rank. She has given me everything. What happens is when you are well read, you remember all the options. When you're not well read, you don't know what is being asked and you cannot recollect. So
Yes.
anyone who recalls the best questions does get a good answer. Same was for Naveen. He had given me such a good paper and he had told me that I'm going to get this score. And I was like, are you serious? You're going to get this score? That time also I said that you will get a very good rank. He also had fifth or sixth something in NEET SS. So I love these students who participate in Telegram groups and who give me the recalls. It
Actually,
really helps.
recalls helped me, ma'am. So that is why I wanted to be a part of help in this. The moment I came back from my exam, I sat down. I penned it on everything. I didn't want to type it in Telegram. So I just penned it everything. Almost 80, 85 questions
That
I
down.
was to recollect.
Yes, you have said most of the questions.
I strongly believe
Oh,
it will help the upcoming to prepare because for me 21 and 20s recall questions helped me. Matlab, I had an idea of how the questions would be, so it really helped me. The recalls really helped me. I thought my contribution would be this.
thank you so much, Dr. Naseema. Now tell me one tip that you would want to give to your juniors.
Ma'am, go through your notes completely. That is, matlab, I know everybody keeps repeating it, but matlab, that is the fact. Going through your videos and notes are something which is going to help and actively participate in the Telegram group. It is not a waste. Matlab, it is, matlab, I'm telling you like 50-60% it is going to be helpful. And then go through your recall videos whenever they are not in the mindset to study and revision.
Wonderful. That's a wonderful tip that
Revision.
you're getting bored with your reading. You don't want to read, then go through the recalls. You'll find them interesting.
Revision, ma'am. Matlab, revision is the key.
Yes,
Revision
one more thing to understand is though there is classes, though all the notes are available, everything is there, but it is quite vast and you have to give in 8 hours every day. Revision, consistency, those words are there. Even if I am just giving you everything in one place, but that doesn't decrease the amount of work that you have to do.
Yes.
You
Revision
have to read a lot. You have to read a lot
minimum
with
of
diligence.
4 times is what the minimum revision is required for
3 to 4 times minimum revision. Yes, from last 3-4 years, students have been saying this, that the revision is the key word to this. You have to keep revising. You have to stay consistent. Wonderful. Last 10-15 days, what was your preparation like? What did you concentrate on?
last 10-15 days was only a notes, ma'am. I didn't go through anything else. I didn't want to divert myself with other extra things. So I just went through the notes. I just kept revising the notes, nothing else. Like I used to make a timetable for myself. I kept timing this within this many periods. I have to finish these topics. Okay. So I went through the notes. I had some three revisions in the last 15 days.
Last 15 days, you had 3 revisions of the notes.
Because I had everything in hand and I have read it multiple times, so I had.
You finish it faster.
I was able to finish it fast.
It is so nice having talked with you, and stay in touch with me and stay active in the group now that
Sure, ma'am. Sure, ma'am. I would love to do that. That is why I told you immediately after my exam, ma'am. I wanted
yes.
to be active. I
Yes,
wanted to
every batch, this question comes from a few students, but I really don't know how to do justice to this. I keep telling them that you are also talented. You can yourself start, taking YouTube
very
videos and
right.
start
But I
taking
wanted to
lectures.
be, I wanted to give my DNB exam and then MRCG part 2 is the next in line for me. So I wanted to finish all my academic at one stretch. So I wanted to be
So
really.
anyone, yes, if you want to teach for MRCOG, we can join up and we can start something. Because I have no idea for MRCOG. I have absolutely no idea. It is something that is scary for me. So if you want to go ahead teaching, we can start MRCOG teaching at our
I'll
represent lab.
prepare it and I'll crack the MRCOG too, and then I'll have an idea. Even now, I'm preparing. I have to start preparing. I was waiting for the results to see how the things goes, and then I have to decide.
Yes, so keep it in your mind if you want to go ahead, because I too have to be selective in who I would let
Sure.
join me. Because I keep my contents, very to the standard. I make sure that it is matching the standard of postgraduates. It is
Your
not a
all
PG exam, FMG exam. It
all
is a NEET SS
contents
exam.
will have the reference. Matlab, even if I want to
Yes.
go through what it is, for example, I still remember Noonan syndrome. Noonan syndrome is something which we don't know, but you quoted a
We
beautiful
don't read
article
also.
on. You quoted an article on it. just curiosity wise, I just went back to the article, and it was a
Yes.
very beautiful article.
It's a beautiful article. Even I did that in my PG days when I was reading. If there's a reference given, I'll go back. If there's time, I'll go back. So that's the last student who I took an interview, Dr. Ramsaveni, she also said the same thing, that I would go to those references and I would read. So this is a kind of reading that we all do. We go to the references.
But you need time for it. Matlab, you should be prepared from your mind. You should be prepared from.
That is not a tip that you are giving to the juniors, but it is just out of interest that some people would always go back to the references to see. That's not a tip for the student. It's not necessary that you go through the references. It is for the extra time that you have.
Paper. That was also an amazing paper. Like pelvic anatomy, surgical pelvic. But again, you cannot read, go through the paper. You cannot recollect anything reading.
Yes, I have summarized all those things, but still I have given reference.
It
that
was
if
really
you want to read more, you go and read from there.
That was also a very hectic topic, very confusing topic. Anatomy, pelvis anatomy was also very confusing topic. A lot of videos of yours actually helped me. Truly, it helped me actually, because certain concepts were unclear and certain concepts were very vast.
And nobody teaches in your PG times, no. PG is for clinical postings. It's for learning yourself. Nobody's going to teach.
PG, we don't have like this only, ma'am. We just have clinical classes weekly twice. That was what was happening in MAMC.
And in those classes also, we have to prepare. Like my residencies days, we had to prepare for seminars and all. We would take the PPTs and the teachers would judge whether we have said correct or not.
So, and we question them back. They will question us back. You answer it. So
yes, ultimately,
ultimately, we won't get the answer.